Hi there, thank you for tuning to this channel. Guys, kuna penye hatuendi poa. There is a place we have messed and we are messing, and we will still mess as long as we don't change. There are people out here, two categories. One, people inside these facilities, either kwa chemist ama hospitali, and the user of the final user of drugs. There is what we call drug resistance. This is whereby you take a drug and you don't feel any change. It comes through exposure to these drugs, more so antibiotics. It is now rampant. It is a problem that is affecting many people and they don't know. You are only hospitalized, you are given this drug, it's not working, they change to this, you are not responding, you change to this. The more you are given more drugs, the more toxic they are to your livers and vital organs. Now, where is the problem? The problem is, number one, these people who dispense, the pharmacists, the pharmacists, or the quacks. When we give drugs as according to the prescription as it should be, there is frequency and duration that gives the dose. For example, an antibiotic that should be taken 3 times a day for 5 days or for a week, for at least 5 days, should be at least either 15 capsules or 15 tablets, depending on the formulation of the drug. But now, due to the greed and the urge to make more money, we don't do that. Not all, a few or majority. If I can say, I stand to be corrected, but it is something that is there. We dispense less than required amount of drugs. This we are passing the hazard or the effect. Now it is the problem that we have created to the user. When the person takes that drug and doesn't complete the dose, and he keep on doing that, or she keeps on doing that, eventually he or she will develop drug resistance. And the more you are being exposed to it, the more chances of getting drug resistance is. This is where you find some people are complaining that these drugs are not effective. Maybe you are selling us fake drugs. No, drugs are just as effective as they were before. The problem is that we misused the drugs. The first problem, people, the manufacturer of the problems, I have said the first one is the dispensers. The second is the users. You at home, when you are given that drug, a full dose, then you take for 3 days and you get well. The remaining you dump them, you keep them for future use. That is a problem. It's a hole you are digging for yourself and you'll never get yourself out. So whenever you are given that drug, and it should be in a prescription for antibiotics, make sure you complete that, because if you don't do that, the problem is yours. You will get into that hole and you'll never get yourself out there. So don't dig when you found yourself in a hole.